Hello, everyone. You're welcome today to channel. If this is your first time of joining us, you're welcome. Nice to meet you. Today, we're going to talk about the differences and the similarities between MSRA and Assessment Center. And with me today is my dear brother, Emmanuel. So he's a clinical research fellow, and I myself, do I need introduction? I don't think so. My name is Carlo. Nice to meet you. If this is your first time of meeting me, also, yeah. Why do we want to talk about this MSRA and assessment center? It's because there's been a lot of questions that came across to us. People who are preparing for their specialty training, they don't know which one that they need to take, whether they're going to do assessment center or just MSRA, or whether the two can be used for any specialty. So today we think it's important to address that information and help people who are preparing for their specialty training application. Without much ado, I'll pass you over to Emmanuel to talk about the MSRA. Emmanuel, over to you.
Yes, thank you, Dr. Carlo, and thank you for having me. Yes, hello everyone. So I'm just going to talk briefly about the MSRA exam, and I'll pass you back to Dr. Carlo to tell us about the assessment center. So for MSRA, so it's a multi-specialty recruitment assessment. So it's an exam that involves that it's used for for different specialties: emergency medicine, radiology, general practice, psychiatry, obs and gynae, ophthalmology, and a number of them. So recently, with the introduction of the GP and public health dual training, so it's also used as well for that screening process. So what is this exam about? So it's an exam that involves multi-specialty. So the questions cut across different specialties in medicine, surgery, O&G, and various subspecialties like ophthalmology, ENT, radiology, and like that. So the exam has two components. There is the clinical problem solving component, the CPS, and the professional dilemma PD, which is what we popularly know as SJT. So the clinical component lasts for about, say, just over an hour. So could last for 75 minutes or more, depending if you have any special circumstances. And the SJT lasts for about an hour, 30 minutes. Of course, more if one needs more assistance or support. So basically, those are the two components in the MSI exams, and you take the two the same time, the same day. So after you're done, depending, you could start to, I think most of them start with the SJT. And after the SJT, you're having like a 5-10 minutes break, and you just go on to the clinical bits immediately. So yeah, so I think that's basically the summary of the MSRA. And yes, we'll be happy to talk more if there's any questions. So over to you, Dr. Carlo. Thank you.
Thank you very much. Emmanuel had just given us a brief summary of what MSRA is. And there we go to talk about assessment center. So unlike other specialties that would use MSRA, UK public health specialty training is a bit peculiar because instead of using the MSRA, they actually would assess their candidates using the assessment center. And the assessment center, it's a psychometric test that would have three components. Recall Emmanuel said the MSRA has two components, but for the assessment center, it has three components. And one of those would be the situational judgment test. The next one is RANRA, and the other one is waxing glazer. The situational judgment text would try to assess what you believe you should do in a dilemma situation in public health. So it's not a text of knowledge, but how you would handle a situation. Therefore, it's sort of developed and prepared in such a way that you don't need to have core public health knowledge to be able to respond to those questions. And the situational judgment text is mapped to the eligibility criteria or person specification that they are looking for an ST1 public health thing. Things around probity, communication, working in a team, and coping and managing pressure. So those are around those areas that the questions would be asked. And for the situational judgment test, it's usually around 100 minutes for everybody. But if you have reasonable adjustments, you might have additional time added to you because of your situation. So, and they're usually around 53 questions, which will be divided into ranking sort of questions and multiple choice. And those ranking questions are already predetermined. The answers are already predetermined. So the nearer your answers are to the predetermined answers that the subject matter experts have included as their best options, the higher your score. And also it is not a negative marking. So you're actually encouraged to answer all the questions, because having to answer a question and not having to answer a question, you're more in advantage to answer more questions. So the next one is the waxing glazer uh, test, which is the second component, and it talks about the logic. It's more like critical thinking, and there are a number of components that they will assess you, including things around inference, interpretation, deduction. So how would you respond to things logically and critically appraise things? So that's the second component, and it's about 30 minutes for that exam. So you're supposed to answer 40 questions within 30 minutes. The last one is BRANRA, which is about quantitative reasoning. So it's applied mathematics, and you're expected to go through how many questions? You're supposed to go through 32 questions in 40 minutes, really. And so the idea is to see if you're able to apply, you have quantitative skills there. And over the 40 minutes you've got, you're expected to answer those 32 questions. So I guess they are not the same in a sense that what is assessed for, for MSRA and assessment center, they are different things, but both of them are the same because they are assessments to enter into specialty training. Or what do you think, Emmanuel?
Yes, like you rightly said, they are both assessments for depending on which specialty one is applying to. So why public health have their peculiarity in terms of questions and what they're trying to assess for the clinical bit, it's just basically assessing your clinical knowledge at F2 or ST1 level. So yeah, I would probably say, and even in terms of SJT as well, for the MSRA, it's more clinical based scenarios. So you'd be likened to an F2 in an emergency ward, in general practice, in of some kind ward. So it just a clinical based scenario at F2 level. So they want you to think and how you would respond as a resident doctor. So yeah, it's basically just basic clinical scenarios for SJT, and for the clinical component, it's just clinical assessment, really.
Yeah, and the other thing to really add to this is that if you are eventually going to apply for another clinical specialty and you want to also apply for public health, you would have to do both MSRA and assessment center. So having done MSRA does not cover Europe for public health, unfortunately. So you have to do the two too. And the other thing that you also need to know is that having done assessment center in public health is just the second layer of the recruitment process. You have applied and you've gone through the assessment center. If you were successful, you'll be put forward for the last bit, which is the selection center. Well, Emmanuel, what do you think about other specialties? Do they have to go for interviews or what?
Yes, so for the MSRA bit, some specialties would do interviews, some others would not. For GP psychiatry, all you need to do is just to score really high in your MSRA, and you'll be ranked according to more like the general score of everyone. So, but for other specialties like radiology, emergency medicine, O&G, you would need to go for an interview. So they will probably invite people for interview after the MSRA, depending on your scores, and then you move over to the next stage to have an interview. Then after the interview, successful candidates would then be ranked and offered based on their rank. So for MSRA, some specialty just need MSRA, GP, psychiatry, majorly, and others, MSRA is just a layer as well, like assessment center and selection center for public health. So depends if you're just doing the public health and GP dual specialty application, or you need it for MSRA, it's just the MSRA, and that will be it. For public health, of course, you go from the from the assessment center and then to the selection center. If you are doing other specialties like O&G, radiology, emergency medicine, anesthesia, you need MSRA, and after that, you then go to have your interview.
Or if I got you right, did you say that if you're going for the GP public health dual, if that's the only one you've selected, won't you have to do assessment center as well as the MSRA?
Yes, so you do MSRA and you do assessment center.
Okay.
Then you then go to, so the only bit you do for MSRA is just MSRA. Then for assessment center, if one is successful in both, they are now shortlisted to have the selection center. So the interview is the public health component of the training. So there's no interview in per se for the GP component. So the interview is public health scenarios, public health cases, and all that. I don't know if that makes sense.
Yeah, it makes sense. And that reminds me, actually, I recently had a chat with a colleague who entered through, who is doing the GP public health dual thing. And from what he said, I mean, I haven't seen that on the internet or anything, but from what he said, that's the selection through the assessment center thing was based on the MSRA. So if you scored very highly in the MSRA as a GP public health dual candidate, you're likely to be moved forward to the selection center as far as you have reached the cutoff for the assessment center for the public health. So it means that colleagues who are interested in the both should aim as high as scoring very high. I don't know, but just aim very high and also pass your assessment center. I think that's it, isn't it?
Yeah. Basically, I think just because the dual training has, I think, just about say 16 slots, 16 to 20 slots, and you have lots of applicants. So the I believe as well that the selection criteria would be based on the MSRA score. So the people with the highest MSRA score that have as well passed the assessment center would be moved over to the next stage. So yeah, I think it's what just giving the best shots to both components of the exams really.
Before we go, we've talked about the plans to undertake a boot camp for colleagues who are preparing for the public health assessment center. So it's something that we're looking forward to go through a number of those components, whether it's JT or RANRA or waxing glazer, to give specific examples and principles behind that. We hope that would be of use to you and peel your eyes and look forward to that. Thank you, Emmanuel, for today. And before you go, if you haven't subscribed to our channel, this is the right time to do that. Don't wait any longer. Thank you very much and have a good day. Bye for now.